Hi, welcome to session 9 on how to enter DIQA data. Today we will be covering how to enter DIQA data directly into the Online PDH Database, and you don't need to use the Excel spreadsheet. So let's get started and log on to wvcmamtest.org/pdhearth, and then you can log in with your login and password. Once you've logged in, please select Data Entry. The Data Entry tab on the right-hand side will have an icon with a little paper and check mark that says IQA. Please select this IQA. Once you select it, you'll see that this has changed to Data Entry. So you can go back and forth between Data Entry for PDHearth data and then with IQA. So I'm going to select Burundi, and because the country breakdown hasn't been entered in yet, I'm just going to select the data uploader for district, data uploader for division, and let's say that this IQA is supposed to be for Bayaga. So I'm going to select Bayaga, and let's say it is for year 2020. The ADP is for MCNE projects. And then we can select either the design tab or the implementation tab. So there's two tabs, or now there may even be three, on the DIQA tool. You would select Design IQA if your PDHearth program is in the design phase, where you are starting to do the community mobilization, the situational analysis, and the PDI and training of the volunteers. If your PDHearth program has already been running for a long period of time, and you know that already you have completed the design of the hearth messages and so on, you can then select Create Implementation IQA. So I am going to assume that we are now working already in PDHearth, and so I'm going to select Create Implementation IQA. So once you have selected Create Implementation IQA, you're going to see, as you scroll down, the different essential elements. And you can put in today's date, or if you're entering the dates for historical data, then you can put in the previous date of when the IQA was filled out. Just in case, for those of you who are not familiar with IQA, it stands for Implementation Quality Assurance. DIQA stands for Design Implementation Quality Assurance. Now, as I scroll down, you can see the essential elements are highlighted with a blue text box. And then within those essential elements, there's different components of the essential elements. So the purpose of the DIQA or IQA tool is to assess the program fidelity of the PDHearth program. Program fidelity means the quality of your program being implemented. So this is important because if you have just the data, it may not be telling you exactly where you need to improve. So if your results are not very good, you can't know exactly what areas of your program you need to improve in order to improve your results. But with this DIQA or IQA tool, it gives you a score for the different essential elements. It's a self-assessment for your program. So I would highly recommend to do the self-assessment for your PDHearth program, for your AP, for your projects, at least once a year. I would highly recommend even twice a year, every 6 months, if possible. So you can take a look at the different components under each of the essential elements, and then give yourself a yes or a no. So for example, the first one, the essential element is caregivers bring daily contribution of food or materials to hearth. The components under this essential element include Hearth menus are shared with the caregivers before the start of Hearth session to discuss the caregivers on who will bring what ingredients on the first day of Hearth. You can say yes or no. If you do meet with the caregivers before the first day of Hearth session and discuss who brings what ingredients, then you would say yes. Volunteers meet with PD Hearth caregivers prior to the first day of Hearth, so they are aware of what ingredients they must bring to agree on a time and location for the first day of Hearth. So the volunteers are meeting and they decide on what ingredients to bring, what time to meet, and where to meet before the first day. So if you do this, you would say yes. If you don't, then you say no. So I'm going to say yes. The third component is caregivers contribute to foods and or materials for Hearth sessions. And I'm going to say no, because let's say yes, sometimes they do, and no, sometimes they don't. Okay. And then there's an optional one where community also contributes materials for Hearth sessions. So let's say that some of the community leaders and some of the community elders, they contribute some ingredients to the Hearth sessions. And you can say yes. And then you would do this for all the different essential elements. And you would go through each of the components and indicate yes or no, yes or no. So I'm just going to go through and just randomly put in yeses and nos. Okay. For yourselves, when you do the exercise and you go through this on your own, I would like you to think of your AP context or your project context and fill out the answers. So if a child doesn't gain weight after 2 sessions, refer the child to the health center. Children with red MUAC or severely acutely malnourished are referred to the health center. Let's say no. No, children are not referred after gaining 400 grams. No. Yes, children, 6 to 10 children per Hearth session, no more than 10. Maximum of 10 caregivers. No, we sometimes have 11 and 12. Caregivers who are absent for more than 2 days or drops. No, not necessarily. We still follow up at home. All caregivers perform all the activities at least once in the 10 to 12 days. Yes, that is true. Caregivers can all recite the 2 key Hearth menus. Yes. The messages. No, not really. Caregivers are aware of the food substitutes for various seasons. Yes, that is true. Monitoring and evaluation. Let's say no for most of these. Exit strategy. No, we don't have an exit strategy. Optional, exceeding expectations. The graduation criteria is clear to community leaders. No. Supervisors report monitoring data to higher levels. No. Results of the PDR data shared with the community. No, not really. An excellent exit strategy exists that will sustain and prevent future malnutrition. Let's say no. And then there are different notes that you can make for each of the essential elements. And then you can also indicate the data source for each of them. Okay. So let's say we have finished filling out the DIQA. And I will put today's date for now. Okay. And then we save. We save by pressing the plus button. Okay. Now it is saved, and we can see that there are scores on the right-hand side. So for caregivers bring contribution of food or materials to Hearth, it's 1.5. The total score is 2 for each of these essential elements. And so if the score is 1.5 to 2, then it's green. that means you're on the right track, you're doing well. If it's 1.0 to 1.49, then the score is going to be yellow. It needs attention. And then if it's red, so anything below 1 means that it really needs to be taken a look at, and you need to assess and see what needs to be done to improve this essential element. So for example, this one, heart sessions run for 10 to 12 days within a 2-week time period. We said yes, there were 10 to 12 days of heart sessions within 2-week time period, but the heart session ran for 4 hours per day. And let's say that the volunteers spend time to reflect with caregivers about the changes. They don't. They don't really reflect with the caregivers on how their children have improved over the session of 12 days. And so we put no. So this is an area that we could improve in. Okay. This is also alarming because there is 0 score for if a child doesn't gain weight after 2 sessions, refer the child to the health center. So we know that the referral system has to be improved. That's another area. We also realize, oh, monitoring and evaluation, the MNE processes also need to be highly improved. And so we can take a look at all the no's that we answered and then see what we can improve in that. And we also need an exit strategy. Okay. So the overall score, IQA score, is 0.38, and this is for July 28, 2020. So we can try and improve these different areas that we identified, such as the heart sessions running for 10 to 12 days within a 2-week period, improving the referral system to the health center, and then the M&E system, and having an exit strategy. And then after 6 months, we would try this again. Or in 1 year, we would try doing this scoring again and assess the program fidelity. And then you can compare the last report, which was done today, with the new report that will be done 6 months later. And you can see how much it has improved in your IQA score. Now, if you want to, you can generate this report along with your data. And so once you have your data generated, you can then compare your data with your IQA score and see in what areas you need to improve. So that brings us to the end of today's session 9, and you can move on to session 10.